Okay, so hello everyone. Welcome to a very special training session today. So I'm going to just quickly check if everything is working, if people on Facebook and our Zoom streaming can see us and can hear us. Yes, everything seems to be working correctly. Loud and clear. Thank you very much, Gediminas, for confirmation. So once again, thank you everyone for joining. As you know, we've just launched two supplements, Nutricode by Dr. Tomasz Jeżewski. And as you can see, mine and your guest today, special guest, is Dr. Tomasz Jeżewski. Hello, Tomasz.
Hello, Marcin. Thanks for having me. Hello, everyone.
Yeah, so thank you very much for joining. Today, we will focus on those two supplements. We'll be talking about the benefits of those supplements, the composition of those supplements as well. We'll focus also on some well-being aspects. But maybe first of all, Tomasz, could you just tell the audience a few words about yourself, who you are and what you do?
Okay, now I am a cooperator of FM World, but of course I am a medical doctor. I specialized in internal medicine and in cardiology. I was trained as an invasive cardiologist, so for more than 20 years I perform different procedures, invasive procedures. But during my medical career, I was started to get more and more interested in lifestyle medicine and let's say scientifically based ways to prevent the chronic diseases, the degenerative diseases, and now it became my favorite topic and favorite uh, let's say specialization in medicine. So that's why I also started the collaboration with FM, because you have this Nutricode line, and we can address some very important issues with the Nutricode product. So that's why we are here.
Mm-hmm. So today we're going to talk about vitamin C bomb, but also about B12 vitamin complex. So what makes you decide that those two nutrients are really essential to be introduced before we go into detail?
So yeah, Martin. So it's more like a question about the philosophy. Why those two as the first products with this signature line? Because let's say vitamin C is so popular, everyone knows vitamin C, but we will try to introduce this very known molecule and essential molecule in a little bit different way. And of course, probably you will notice where the differences will be and what we will try to stress with this vitamin C. So let's call it a different approach to the known story of vitamin C. And the second one is maybe more surprising for a lot of people, for maybe for a majority of you. But for me, it's not a surprise, because I don't move without my vitamin B12. I am B12 dependent, I call myself. This is a really essential vitamin for me. And for people who are aware of the fact how important the vitamin B is. And here is a little bit different story, and we have some contrast during this webinar, because everyone knows about vitamin C, but majority of us don't know enough about benefits of vitamin B12, and I will try to share my knowledge. and share my practical experience from my practice with my patients, from my experience, what we can gain if we learn how to balance B12 vitamin, and those benefits can be huge, believe me, and there is more to come.
Okay, so now I am going to share some slides that will help us to structure our conversation as well. And everyone can see, even if they jump into the middle of the conversation, where we are and what we are talking about. So I'm going to just open the slides. Okay, so I think slides are up. Yes, so before we start talking about those two powerful supplements and really innovative supplements, let's focus a little bit on prevention versus intervention in medicine. Because as far as I know, you are a big fan of lifestyle medicine, and your experience that you're talking about proves that. So how does focusing on prevention differ from traditional medicine intervention, and why is prevention such a key aspect of your approach?
Yeah, I guess that we have to stress it that we have one set of organs, we have one body, and we have our life to live to the fullest and to gain most benefits and to be happy and energetic. So the best way to achieve those goals and keep in good shape and live long, happy life is to prevent. Because, and this is more like Asian approach to the medicine, it is conservative, preventive medicine, and not exchanging damaged parts, which is closer to the Western approach to the healthcare and medicine. There is no better way. I have to stress, no better way to take care of yourself than with good prevention and scientifically proven prevention, because I have to stress it that we will have citations, scientific references for all we will talk about during this webinar and next webinars concerning the new Nutricode products. This is very important because we don't want to have, let's say, an image or impression that we do something alternative to the mainstream medicine. This is contemporary academic medicine, but we try to focus on the preventive side of this medicine.
Mm-hmm. Yes. If you haven't, all the viewers, our business partners and customers, if you haven't seen that yet, you can download two product brochures about those two supplements that we're going to talk about today. You can find all scientific evidence that proves the efficacy and effectiveness of the ingredients that we're going to discuss today. And also, those brochures contain much more information that perhaps will be quite beneficial for you. You can broaden your knowledge, and you can also educate your customers as well. Now, we're moving forward, and you mentioned that it's better to prevent rather than to treat, and that's pretty logical statement. But unfortunately, a lot of people nowadays, they don't have enough knowledge and they don't know how to prevent. And actually, the proof of that is the standard American diet. More and more people are becoming aware of it and the negative effect of this diet, but there are still a lot of people who are not really aware of that. So if you can explain how the standard American diet contributes to chronic health issues and why is it important to shift away from it?
Yes, Martin, it is, of course, the diet is the single most potent factor influencing our lifestyle. That's why we talk about this standard American diet as a huge example, because we are referring to the big country, to the biggest, let's say, industry in the world, but the abbreviation of this kind of diet is just sad, you know.
It is sad.
It is sad. Yeah. So our problem is that we go in the wrong way, and we go deeper and deeper, and we will face the consequences of this mistake, because what we see now, it's not all. We have very sad prognosis, like sad diet. We have sad prognosis for the future. And those prognoses are concerning chronic diseases, but also the oncology, cancer problems. We see constant growth of the risk and morbidity and mortality look just sad. Let's keep to this abbreviation. The problem with the diet is that it's more and more processed, it's more and more convenient, which is not good, because in Japan kids cannot bring their food, breakfast to school, because they have to learn how to prepare their food, their meals from the scratch. And this is the example of a different culture of taking care of your body, of your health, and that's a huge contrast. This is a contrast that reflects in the mortality and morbidity from different, let's say, civilization diseases. And this kind of American standard diet is one of the main factors contributing to this disaster. Now, thanks to this kind of diet, now the food related diseases are #1 risk factor, and they just overrun the cigarette smoking, and now the diet related diseases are on the first place. We go in the wrong direction with this kind of diet. Of course, there is a huge industry behind it. There is a huge marketing, and this is this huge convenience and comfort diet. But you have to answer for yourself what you want. Do you want convenience, or do you want to be safe and feel good? And concerning our today's topic with the Nutricode products, there is a huge nutritional gap, and this gap is getting bigger and bigger, because this kind of diet is not very dense in very important compounds, but it's very dense in calories. So it is not it's a calorie dense, not nutritional dense diet. This is very important, because those parameters of such a diet is getting poorer and poorer, because the food is more and more processed.
Yes, food is more and more processed, contains a lot of preservatives. It's very often full of sugar, just to give it some flavor. And that is, as you're saying, the first step to chronic diseases, but also chronic inflammation within the body. I know that you are a big fan of plant-based diet, and that's why our new supplements are suitable for vegans and vegetarians, which perhaps is a very good news for those of you that you follow the vegan or vegetarian diet. So now let's focus at first on vitamin C bomb. So yes, we've got, everybody perhaps knows ascorbic acid. Everybody knows vitamin C. But what distinguishes natural vitamin C, like our C-bomb, from synthetic ascorbic acid in terms of absorption, effectiveness, and so on?
Yeah, you know, Marcin, the answer is very simple. It's the simplest possible answer, because vitamin C was always meant to be delivered with our food and with the organic, let's say, herbs and plants that is included in our food and our diet, daily meals. So we, from the ancient times, we will learn to recognize the plants that naturally contain high amounts of this very important vitamin for our health. So it was always meant to be organic. And what we do with the C-bomb Nutricode, we just back to the roots. We want to make it back organic. You know, I'm sure you know a lot about vitamin C. You saw many supplements with vitamin C, okay? But there is a lot of information and misinformation about vitamin C, okay? Different brands try to, propose different doses, different forms, but they always focus on the maybe liposomal, maybe absorption, but we are still in the chemical synthetic forms of this vitamin. And we will talk about differences in a moment. So what we do with the vitamin C in our product is back to roots, back to organic forms. Why we should do it? Just to be on the safe side. We have some requirements for vitamin C. We know what happens from the history if you do not fulfill those requirements, the stories about the sailors, about the scurvy and all the stuff. Everyone knows a little bit, at least, about those problems. So there is an essential substance, and we try to deliver it as in the nature was from the ancient time with the organic forms. The problem is with this nutritional gap, we do not deliver enough because people, we always say, eat your fruits, eat your veggies. We do not fulfill those requirements. For kids, for adults, we do not eat enough plants in majority of us. So there is nutritional gap. The second problem is we have too low, and we try to supplement with the chemical ones, but the bioavailability of the chemical vitamin C is quite poor comparing to the organic. And you will see in this PDF brochure also the data backing up what I'm saying now, that we have much higher bioavailability of the organic form. And what is already absorbed in our body, if it's organic, it acts, the action is 2 times more intense concerning the antioxidation parameters with this organic compounds. So it's a huge difference in effectiveness. The best picture of an example for this is the one study where researchers took vitamin C, but from the apple pulp. Natural, apple a day keep the doctor away. So they took apple pulp, and the amount of the apple pulp was equal 5.7 milligrams of vitamin C, okay? And they compare the biological action of this less than 6 milligrams of vitamin C. And this 6 milligrams of vitamin C was equal to 1500, one more time, 1500 milligrams of chemical vitamin C. This is only to show you what is the biological difference for your body. How the same chemically, it's the same molecule, but if you give it in the organic way, within the organic compound, with all the other substances, bioflavonoids, fiber, phytonutrients, other vitamins, minerals, because it was always like this. The biological action of this alone, ascorbic acid, is so huge and so effective comparing to the chemical one.
Mm-hmm.
And
so we can say that that basically bioavailability is means how effective a certain substance is absorbed by the body. So this is the term bioavailability. So when you take a natural vitamin C that comes from different extracts, and it contains bioflavonoids and phytonutrients, all of this helps the vitamin to be absorbed much more effectively compared to a synthetic one. So I think that's the reason why the amount of vitamin C in this product is relatively small compared to a synthetic vitamin C available on the market, which sometimes could be 1,500 milligrams. But when we compare those two products, we can clearly see, based on what you said, that when you take a natural vitamin C, your body will absorb much more compared to the synthetic one, so up to 35% more bioavailability compared to the synthetic one. So it means that when somebody takes the synthetic one, even if the amount is higher, unfortunately, a lot of the vitamin C will be excreted with urine, producing quite expensive urine, basically.
Yeah, and not very healthy one, because you know, there is a simple rule for every substance in pharmacology and medicine. If you give too small amount, there is a homeopathy. Sometimes it doesn't work at all.
Mm-hmm.
You need to give a proper dose, but in our definition, proper dose is the dose that gives you all the benefit. There is a nice biological action of the molecule, but we try to not risk the side effects and too much interactions. So we look for the sweet spot of the concentration of the molecule. But on the other side, there is a huge doses, the mega doses of certain molecules. And this is the case with vitamin C, because some products are being marketed as high dose, high content of ascorbic acid, but it's chemical one. And what we see is, of course, some biological action, but your body has to do something with the excess of this ascorbic acid. Of course, the one thing is the absorption in the gut. It will be lower because your body defends against this too high dose. And the second is the excretion. So you give additional work to your kidneys, and there is a risk of some problems of oxalate stones formation. So why to take this kind of risk? And of course, a lot of people who take those high doses, just they can just check it. It's a simple urine sample. They can just examine the urine and they will see a lot of ascorbic acid being excreted. And this is unnecessary health risk. We don't want to, with this kind of supplement, we avoid this kind of risk because the dose itself, as you said, is not so high, but the biological effect, because of its organic background, is so much higher than this high dose chemical vitamin C.
Yes, so it is very powerful. So our vitamin C, our new vitamin C bomb, is derived from whole food sources, so plant extract. So we've got acerola, we've got amla, we've got white rose, and camu camu. So can we just briefly explain why these plant extracts? What's special about that?
Marcin, the philosophy has to be simple. And it is simple. I took the most vitamin C dense plants on this planet, let's say. We can call it four musketeers, or we can call it four best football players. But I want all those four best football players playing in one team. Let's call it Real Madrid or Tottenham. I don't know what's your favorite one, but we can do it. We can pick four most rich and potent sources of organic vitamin C. That's why we took acerola, amla, white rose, and camu camu, because they are so dense. And to give you some example, that the glass of acerola juice contains the amount of vitamin C, which is equal to 5 kilograms of strawberries or maybe oranges.
Yeah? Oh, wow. So no one is going to eat that sort of amount of fruit, right?
Yes. That's why it was quite easy, because they are so dense, to put it in a small capsule and to be I call it fire and forget. With the one capsule of this C bomb, you can be sure that you have no more problem with balancing vitamin C action, not concentration in your urine, but action in your body. So these are very nice four compounds, and of course those compounds, apart from the amount of vitamin C, they have different additional very nice actions, so they are more interesting.
Yes. So those extracts contain other minerals, they contain other vitamins as well. Everyone can read about that in the brochures that are ready to be downloaded from our website. Let's now focus on the benefits. I think those benefits that I've pointed out on the slide are pretty understandable by everyone. Everybody knows that vitamin C is important for immune support. It helps to fight infection. It's very important for collagen production. So it stimulates the fibroblasts to produce natural collagen. So we can say it has anti-aging benefits as well. Cardiovascular health, very important as well. But the first thing that I would like to ask you about is antioxidant protection, because that may not be very clear for everyone. What does it mean, antioxidant protection, and how could you explain that benefit?
Okay, so
there's something which is called oxidative stress as well. So if we can focus on those two things and try to explain in an easy way, so everyone can understand.
Of course, during the biochemical processes in our body, all the times, from the beginning of our life to the end, we produce some waste, let's say. And those are kind of molecules of substances which are very reactive. And this is like small fires that has to be, put down in our cells, in our mitochondria, everywhere. And it's normal because it's a like byproduct, side product of the biochemical reactions. And it is normal, but you need to have firefighters with the extinguishers. If if there everything is okay and you have enough firefighters and enough, let's say, weapon extinguishers, safety measures, there is no problem because all those micro fires in your cells will be put down immediately. But what we see nowadays is that the people tend to have chronic inflammatory response. They have chronic inflammatory stimulation and they cannot cope with this inflammatory activation on a daily basis. And this is a huge problem. So I would say that majority of us has this problem nowadays because they do not have enough firefighters and they do not have enough extinguisher to put down all this inflammatory fire in the cells. And vitamin C is the one, of course, it's the one in this puzzle of many factors, but very important one because vitamin C reduces oxidative stress, so helps to put down those fires. It protects the cells from damage, but it also helps to regenerate other molecules that are important in this response, anti-inflammatory response. For instance, vitamin C helps to regenerate vitamin E to the active forms. So this is very important puzzle in this picture. If you have enough biologically active vitamin C, you can put down those fires more easily. And we see it. But of course, you can feel better, but if we draw some blood and we examine some inflammatory markers with the good balance of ascorbic acid, you see decrease in the inflammatory markers. And this is the picture of how it acts, how it is effective. So it is very important for rheumatoid diseases, for autoimmune diseases, for the cardiovascular, atherosclerosis, for the blood pressure even. So the impact is huge.
Now, if we can focus a little bit on the cardiovascular health, if you can touch a little bit the base on cardiovascular health and vitamin C from your perspective as cardiologist.
Yeah, of course, the atherosclerosis, which is the main problem in cardiology and number one, let's say, a background of the number one killer, because cardiovascular diseases are, let's say, called the number one killer in the contemporary world. The atherosclerosis, so the degeneration of your blood vessels, is an inflammatory disease. It is a chronic inflammatory degeneration of your blood vessels. So if you have effective mechanism to stop this inflammation, to reduce the level of the inflammation, you have, let's say, majority, the main part of the solution of your problem. So even if you approach cholesterol, we will talk probably in 1 month's time about the cholesterol. So we produce cholesterol, and cholesterol is very important, but not oxidized cholesterol, because oxidized lipoproteins and oxidized cholesterol is deadly, let's say, because it makes this atherosclerosis, grow faster. So we need to keep this inflammation in our blood vessel low to be on the safe side. We need to prevent the oxidation of our cholesterol. We need to keep, let's say, elasticity of our blood vessel. With the vitamin C and proper collagen synthesis, our blood vessel will be very elastic. Even in the elderly people, we will keep them elastic, and they can, contract, they can relax, because they act properly. If you have stiff, let's say, blood vessels, stiff tubes, they cannot regulate. So it is very important from the cardiovascular point of view that you will have enough of very active vitamin C.
Mm-hmm. Okay, so before we move forward, I've got a few questions about vitamin C bomb. I'm going to just quickly recap what we've just said. So first of all, vitamin C bomb is a natural vitamin C that comes from plant extracts, which are one of the richest extracts in vitamin C in the world. That makes it very, very bioavailable. It means the absorption of the vitamin C will be much higher compared to a synthetic form of vitamin C. In addition, because C-bomb comes from plant extracts, those plant extracts contain other vitamins and minerals, but also other nutrients like bioflavonoids or phytonutrients. So it's far more than just vitamin C. And it's very important. It can give you all the benefits. It can protect you or boost your immune system. It helps to improve collagen synthesis. It's very strong antioxidant, as we've just explained, and it's really good to protect and support your cardiovascular health. Anything else with the recap?
Yeah, Marcin, it's nice to stress that you made this very nice table depicting the content of additional vitamins and minerals, and you will find it in the PDF. And there is a lot of information we didn't talk about today, which is included in this PDF. Please study this because it's dense in information. Yeah.
Mm-hmm. Yes, and also our vitamin C is recommended for adults, and that's what's stated on the label. But because you are a medical doctor, you are a cardiologist, in the guide, people can find some extra recommendation, adjusted doses for different age groups and different needs. So could you just tell us a little bit more about that?
Yeah, of course, as I said, this kind of product is an all-rounder. It is for everyone. One cups a day. It's a maintenance dose. It's not only for the winter and the infection season. It's all year round maintenance dose. But of course, there are some special subgroups like people who have active inflammatory processes. For the elderly people, people with immunodeficiencies, for the pregnant people, for the lactation period. Of course, those special groups need to be, of course, under supervision of the healthcare provider, but the demand for the active vitamin C is a little bit higher in those instances, and then we double the dose of this vitamin C bomb supplement, and for the period of the let's say inflammatory activation, it's even easier to put this inflammation down.
Mm-hmm. Okay. Tomasz, as we said, this vitamin is suitable for vegan and vegetarians because the capsule is not made of gelatin.
Yeah.
But there may be some people who's got trouble swallowing pills. So is it possible, for instance, for them to open the capsule and put the contents of the capsule into the water, stir it, and drink it?
Yes, Martin, of course. Apart from the taste side, because I didn't taste it mixed with water yet, but of course it is possible because it's a fully organic product, so it's not a big difference apart from the taste. I didn't try it, but it's of course not a problem.
Mm-hmm. Is there any group of customers that you wouldn't really recommend this product to, apart from those ones who are allergic to any of the extracts?
Yeah, no, because vitamin C is essential for us. You cannot be healthy without it, and this is the fully organic product. The only thing is allergy, the only issue is allergy and some interactions, but those interactions are, let's say, on the safe side because we see interaction with some antiplatelets drug, with some diabetic drugs, anticoagulants, and antihypertensive drugs. But if we see that our glucose is going a little bit lower, our blood pressure is getting lower, and need for anticoagulants is getting lower. It means that our body just took over the control more than before, because with the help of this supplement, the need for this kind of medication is lower. So this kind of interaction is a sign of biological action of the product. So the dose of the antihypertensive drug, of the anti-diabetic drug like metformin or insulin on other, should be recalculated, taking into account that the body is just getting healthier. But of course, you have to take it into account and consult it with your healthcare provider.
Mm-hmm. Okay, perfect. So let's move on to the next supplement that we've just launched, which is double B12 vitamin complex. So again, most people are familiar with vitamin B12. Maybe not everyone is familiar that there are sort of two forms of vitamin B12. So we've got methylcobalamin and cyanocobalamin. So our vitamin B12 is based on those two forms of vitamin B12. So what's the difference between those two forms? Why we've got two forms and not just one?
Of course, I did online course only about one vitamin, and it was about the vitamin B12, and it contains 36 modules about one vitamin. So the topic is huge, but I will try to make it brief. As you said, we have two kinds of cobalamins in this supplement, but it doesn't mean that we have only two kinds of cobalamins which are important. There are at least five. Cyanocobalamin is not biologically active in the moment you swallow the pill. It's not active, but your body will convert cyanocobalamin to the other forms of cobalamins. Okay? So it is not active, but ready to be converted. Okay? Ready to be converted. And it is important to have this not active ingredient because it can be converted to the hydroxycobalamin, and it can be converted to the adenosylcobalamin. Yeah, you see it, we have a nice range and this kind of elasticity. Our body will decide how to convert this cyanocobalamin to other forms according to the need of the body at this particular moment, okay? And the second issue with the cyanocobalamin is this is the most popular, let's say, kind of cobalamin in the market of supplements, because it is very stable. And yeah, you are safe because the cyanocobalamin is very stable, so it can be put in the supplement easily. And the second is methylcobalamin. Of course, we could rely only on the cyanocobalamin, but some people, and we never know who has this problem until you do sometimes very sophisticated tests. Some people have problems with methylation. So some people will have problems with converting cyanocobalamin to the methylcobalamin. That's why we want to be 100% sure that this supplement will solve all the problems with vitamin B12, and not only with the level of vitamin B12. We want to fix the problem with the action of the vitamin B12. That's why we have methylcobalamin also. It's half of cyano, half of methylo in this B12, double B12. And methylcobalamin is immediately active. It's immediately biologically ready to action. And we can talk about a list of 15 main kind of benefits you can gain from the vitamin B12 supplementation. You will find this list in the PDF because it is a lot of information. But what you need to know that this is the very flexible product. Some is not active but ready to convert according to the need of your body, and the second part is looking for action because it's immediately active. Okay, so it was about why it's double, and because
yes, so
we want to be sure.
we know why it is double, not just one.
Yeah. So this vitamin B12 is more important for me even than vitamin C we talked before, because you are not aware how many people have problems with vitamin B12. Why? Because we have clear food. The answer is so simple. We cleared our water from the bacteria. We cleared our food from bacteria. We took the bacteria, and we have a lot of benefits because we have clear food. But we have one problem. There is one vitamin which is essential, which is important, which gives a lot of benefits to our body. But it's made by bacteria. Vitamin B12, it's not made by animals. Bacteria produce cobalamins. And naturally, in the history, people were drinking water from rivers. They had, of course, vegetables, fruits from the tree, and they were eating it directly. And on the surface of our food, there were a lot of bacteria rich and producing cobalamins. Now there is an offset, let's say give and take. We have some benefits, but we have risk. But we didn't address this risk of deficiency properly. And people are not aware, and the deficiency in the vitamin B12 is a huge undiagnosed hole in medicine, because even doctors do not address this issue properly. Mm-hmm. The issue is so huge that now we estimate that 70% of people 50 and more years of age, older than 50, should supplement vitamin B12, 70%. Mm-hmm. And everyone older than 60. Everyone, 100%. And it is an official statement. if you want to check, there are some very simple diagnostic tests, of course, B12 level, but level of homocysteine. You can draw some very important information, giving you clues that you maybe that you would have problems. You could have problem with the function of B12 from the blood morphology. Simple measures, but if you are not focused, if no one tell you that you can have problem, you are not, you don't you are not aware of the risk, and you are not aware of the consequences of this kind of functional deficiency of B12.
Yes, you mentioned homocysteine. We know that people who are vegans and vegetarians, they may suffer from B12 deficiency. But even people who eat meat, they may also suffer from vitamin B12 deficiency. And you've mentioned the blood test. And a lot of people who do eat meat and potentially provide their body with vitamin B12, when they do the blood test, they can clearly see that they may have a high homocysteine level, which indicates lack of vitamin B12.
Yes, lack of vitamin B12 action, because we have two different stories. Sometimes I see people who show me their lab result and they have B12 level, and they say, okay, doctor, this level is a proper one. I'm within the normal range. But if we look on the homocysteine, it's not normal. Sometimes, and it is quite often, that we look for a proper function. What we see, we want to feel better, we want to be healthy, not, we don't want to have only the good lab result. You agree with me?
Yes, I agree 100%. But what we need to emphasize here, that if you don't have sufficient vitamin B12 and the B12 doesn't work properly in your body, you are going to have higher homocysteine level. Because if your body is working well, vitamin B12 should remove the excess of homocysteine from your body, right?
Yes, there is a trick, because homocysteine is amino acid,
Yeah.
but it's a false amino acid. You cannot build homocysteine in your protein. So if you don't have enough B12, the level and the amount of homocysteine will start to grow in your body. And this kind of excess of homocysteine will pose a very particular health risk: cardiovascular, neurological risk, thrombosis risk, and many others. So you don't need the excess of homocysteine, but to dismantle this homocysteine bomb, you need to have a proper amount of active B12.
Yes,
As simple as this.
that is very important, and everyone can get it checked. So if you go to your GP, you can ask if you can have your homocysteine level checked. That will give you a clue whether you have enough of vitamin B12 and whether your body is working properly. So now let's move on and talk a little bit about the benefits of vitamin B12. As we can see here on the slide, it supports energy, nerve function, and also red blood cell formation. So
Yeah.
could we just talk about the benefits?
Yes, my favorite benefit, and the benefit everyone will notice very quickly after 3 days to 1 week from the start of supplementation, is the energy level gain and the better focus. And it is my favorite, because yeah, everyone likes to see the effect, and the effect should be quick in the ideal world. So this energy kick is the quickest effect we observed after the balancing, let's say, vitamin B12. But there are many other benefits. This is B12 is crucial for not only for the brain function, it's for the whole nervous system function, because our brain cells have need to have proper conductibility from one cell to another. And the parts of the nerve cells are called axons, and those axons have, let's say, a protective sheet around, which is called or made of myelin. And you cannot synthesize properly myelin, this protective sheet of your nerves, if you are deficient in vitamin B12. So there is no way your nervous system will act properly without active B12, let's say, balance, yes? So this nervous function, cognitive function, anti-dementia, because if the first action of for the patient who is depressive and elderly and comes to the psychiatric, let's say, consultation or department, should be checking B12, because this is the kind of depression from the deficiency of B12, which is very easily reversible. But you talk about this homocysteine. Not every patient is going to convince his or her doctor to prescribe the homocysteine test. That's the real life. Sometimes you have to pay for it out of your pocket, and it's important. So the nervous system function, the cardiovascular
But also, if
protection.
somebody is lacking vitamin B12, they're also likely to suffer, for instance, from like tingling sensation from the nervous system. So that could be some kind of indication as well that there may be a lack of vitamin B12.
Okay, we don't have to look very deep. My colleague, which is orthopedic, which is medical doctor, suffered a strange sensation on his tongue. And he went to the laryngologist, to the dentist, just to check what's going on. But the answer, they didn't find the reason. The answer was B12 deficiency. And he is medical doctor. He is on an omnivore diet. He's not vegan. And he suffered neurological symptoms of neuropathy because of B12 deficiency. This is a huge hole of undiagnosed B12 deficiency. And it's so easy to address. And as I told you, we focus on the B12 as a vitamin for the vegans, and it's not true. It's a very big, unrecognized, let's say, target for supplementation of B12.
Yes, so definitely for energy. So would you recommend to take it in the morning in that case, rather than in the evening?
Yeah, what I do personally is I'm taking my B12 as a first supplement in morning.
Yeah, just to provide you a kick of energy.
Yeah, and there's an additional issue that B12 has a two mechanism of absorption. One mechanism is what everyone knows. It's active absorption, and you need some acidity in your stomach. That's why people who take anti-acid drugs will suffer sooner or later problems with B12. And just imagine how many people take everyday antacids. Those people will have problems with B12, but the problems will show in a couple of months or maybe in 2 years' time, because you have some stores of vitamin B12. Yeah. So the same problem is with metformin. People who take metformin very popular drugs for insulin resistance, for diabetes, metformin will cause problems with B12 absorption. Who talks about it? It's a huge group of people that will suffer vitamin deficiency, in this case, B12 deficiency.
Yes. So a very popular drug that reduces the acid in the stomach is omeprazole. So basically, if someone is on omeprazole and it's been on omeprazole for a very long time, is highly likely to be B12 deficient.
Yes, of course. And that's what I see every day in my practice. So I want you to remember, because you cannot remember everything from this webinar, that the group for B12 is huge, and it cannot be connected only with the people on a plant-based diet, because let's say people with the B12 problems, this is a very, very big group. But we need to address this issue.
Yeah. And also, I just want to discuss now a little bit the directions. Obviously, the directions that can be found on the label are for general population, considering the dose. But again, in the product guide, you've recommended additional dosage, adjusted dosage. For example, for vegan, for the elderly, or even for pregnant ladies. So could you just quickly explain that, please?
Yes. The first point that this double B12 relies not only on this active absorption, but also on the passive absorption. That's why the dose in the supplement is quite high. If you look on the RDA, let's say, you will see a lot of percent, because the dose in capsule looks very high. But this is on purpose. We did it on purpose. We want to rely not only on the active absorption, but we rely also on the passive absorption process. And we know that maybe only 2% of the dose will be absorbed. That's why you need to know why this dose is quite high. And now I just had to comment on this, because I jumped to the kids. That's why this kind of supplements, it's not intended for the children below 4 years of age. The dose is just we don't have dosing elasticity with this kind of high dose. If the children are from 4 to 8 years of age, it's enough to give 2 cups a week. So 2 days during week, 1 cup, and you can be sure that the dose is sufficient. From 9 to 13 years of age, 4 cups a week. So let's say every other day. And we treat teenagers older than 14 years of age the same as adults. So every day 1 capsule. And now I'm at these special groups. If you are on a plant-based diet, there is a need for 2 cups a day. If you are above 60 years of age, the demand is higher and the absorption rate is lower, there is a need for 2 cups a day. And of course, pregnant women and lactation, this is a special moment, and then the demand is higher, but of course under the supervision of your healthcare provider. These are the special groups, and for me, I will take 2 cups a day, of course.
Yes, this information and far more, again, can be found in the product description, the brochures that we've produced. So just download them from the website. Also, they are linked to the products in our online shop. Now, just to quickly recap the things that we've just said. obviously prevention is the key. So we need to focus on lifestyle changes and also nutrition in order to prevent diseases. Vitamin C bomb is all natural, highly bioavailable. It means the absorption of this product is really, really good compared to a synthetic form of this vitamin. It helps to enhance your immune system. It's beneficial for the skin as it helps to produce collagen, and it's really good for cardiovascular system. Vitamin B12, we've got two forms. One is active, one is not, but that ensures that this vitamin will be absorbed by everyone, right? So this product can be offered to a bigger population. And vitamin B12 can be deficient in not only vegans and vegetarians, people who eat meat can be deficient as well. And one of the indicators is homocysteine level, for example. We've discussed that it helps with nerve function, it helps with energy production, it prevents anemia, so it's good for red blood cells production, and also it can be used by kids 4 years or older, but the extra recommendations of the dosage can be found in our brochures. So basically, I think we've discussed everything today, what we've planned. I have a suggestion. If anyone has got any questions, you can just submit the questions by email, or you can just post the questions under this recording, because this recording will remain on our Facebook. I will gather all of the questions, and maybe in the future, in the near future, we can organize another webinar and we can address your frequently asked questions. Would that be okay, Tomasz?
Yes, it will be perfect, Marcin. I just wanted to say that those supplements are, let's say, my essentials, because they are so important to me from my, let's say, medical perspective and my experience. So they are very important. I hope they will be also for you. These brochures are very important also because they are information dense, and I'm sure you will have some questions. We will try to address them. And one more information is that we will also try to gather the group of, let's say, patients or clients who will of course, perform the baseline examination, and we will try to start this kind of supplementation and check the results after a couple of weeks or a couple of months, just to also show you how those parameters change. This is predominantly the case of B12, because you need more information about this vitamin C you are more familiar with. But both of them are very important, and you have to believe me.
Perfect. So that is a very good news. We're gonna have our private clinical trials.
Yes.
And we're gonna see the real life results before and after, but from the scientific point of view.
Yeah, I think that's why you have doctor on board.
Amazing. So thank you very much, everyone who was joining us. And thank you very much, Tomasz, for taking the time. And yes, see you during the next training sessions when we'll address the frequently asked questions.
Thank you, Marcin. Thank you for having me. Have a nice day.
Thank you very much. Take care, everyone.